I remember the day that I first met you. You came to the office and saw me, even though your mom had passed away that day.
Yeah.
And you sat with us and you talked to me and you looked at my history at that point in time. At this point in time, I was running a big division at Dell, $8 billion, 40,000 people running around, 700 emails a day, whatever, some number, something like that. And you looked at me and said, your health is not in a great place. You have too much information. You have thoughts running after thoughts after running after thoughts. I think that's the exact words you used. Your blood pressure was sort of out of control and you have too much weight. You were overweight and you said you need to make drastic lifestyle changes should you want to live. That, along with another thing that happened, I remember going to school one day with my daughter, and my daughter, I had not spent a lot of time with my first daughter because I was busy traveling all over the world. And I was complaining to a parent saying that I have to do carpool today and I had to spend 45 minutes in carpool. And she looked at me and said, that's the best part of my day. I get to spend time with my kids. And I said, what is wrong with me that my health is off?
Yeah.
I'm running around. I'm enslaved to this company, not spending time with my family and my kids. Something is going to happen someday to me. It's not worth it. And I literally walked away from the biggest job that I ever had. I walked to my boss, who was new, and I said, Steve, I'll make a deal with you. I'd like to leave. He said, if you can find your successor, I'll let you leave. And I literally walked away without a backup plan. And then I tried to implement all of the things you told me, which seemed very hard to me. I'll give you an example. You said you got to stop drinking coffee.
Yeah.
And I said, are you kidding me? I drink 8 cups of coffee. It's what keeps my energy. And I realized that when I gave up coffee, energy came in a different way.
Exactly.
Right? But I didn't realize I could even do that.
Exactly.
You said for some time you have to give up gluten.
Yeah.
For 6 months or something, I gave up gluten completely until my system reset because of the inflammation that you talked about, right? So you said, hey, you have inflammation, you have very high cortisol that's causing all of these problems, and you gave me some supplements as well. It took me a very long time to be able to accept what you had said and slowly make those changes. And I think I'm still learning. I have a long way to go.
I know what I say, that if Dr. Sodhi follows what Dr. Sodhi says, he'll be not sick either.
It's a very hard journey.
Exactly.
And I don't think I'm there yet. I'm a long way to go.
Exactly. So I just wanted to hear your wonderful story about how you did it, and then you come out of it too, because that's that's the beauty of it. What you did, that you said, okay, you take to the top and then back off. The detachment, because I think one of the biggest in our religion, we talk about detachment, and you are actually practically doing those things, which is I'm trying to learn in my personal life that.
But Dr. Sab, I learned it from you. So I'll tell you, one of the biggest challenges that I have is to, and I learned Ayurveda through you. And you said, the Pitta dosh is something where the entrepreneur typically has high fire. You're constantly thinking of new things, right? And because you have that, inflammation is easy to get. I think this is what you explained to me. So this is something I battle with every day. How do I continue this creative journey and want to go build things and yet manage the downside of that, which is inflammation?
There is no one-way traffic. There's always two-way
There's always two-way traffic. There's always a price to be paid.
Exactly.
There's a bill coming, right? And I tried to measure. Access was exactly that. So we built a good company, but we felt that where we got it, somebody else needed to take it to the next level. And this is one thing that I don't know where it comes from me. I'm able to walk away from it. And I'm still involved. I still want to make sure that it's in the right hands. Our people are taken care of. Our clients are taken care of. And our stakeholders who bought it get a good return on the investment. That's very important to me. But I'm not involved in every detail like I was in the past. And that has helped me with some mental peace so I can go on to something new.
Yeah. So one interesting thing, you were managing around 30,000 employees. And how did you do that? And keeping your health at the same time?
Dr. Sab, it's very difficult. But when I started my second company, if you remember, I went back and talked about walking away from Dell. I made one deal to myself based on this conversation I had with this lady in school, saying that I will not miss any of my kids' events.
Cool.
Okay?
So
and we ran that company from 2012 to 2025 when we sold it. I think there may be 1 or 2 events that I missed. That was a deal I made. And I said, I'm going to try to turn off at some point in the evening. I don't think I've succeeded. I failed many times at that. But I definitely went to all of my kids' events and I tried to keep all of my family commitments. I think I failed along the way as well, but I really tried hard.
You've been biggest philanthropist. You have the food bank. Can you tell the story about that? You fed multi-million people during COVID times, and amazing work of seva which you did. And you not only do it here, you also do, I think one time you shared that you were building some houses for the poor families in India, and not few houses, hundreds and hundreds of houses you guys were building. So please tell us about that.
Well, we grew up in India where poverty is, you can see in your face. And I think our families were always believed that the resources were meant for other people and that you are stewarding these resources and that your responsibility is towards other people. And if you have these resources, they're really meant for other people, and some of them you can enjoy. The rest is meant for other people. I think the family told me. I will tell you, I forgot that when I came to the US, because I got into the American dream. I started running big companies. It was very important to me to be a big guy in these big companies. I got stuck in the racket. I think we did well, but we got stuck in it. So in 2011, one day I went to the office and I fired 7 people. Okay, and these things happen in large companies.
Yes, sir.
The last guy looked at me and started crying. And he said, I don't think I'll be able to put food on the table tomorrow.
Wow.
And I was like, really? And it hit me. So I got in the car and I started driving home. I called up my wife, Gunjan, and I was talking to her. I was complaining about my day like I was the victim here, that I had to do this. And I was stuck in a traffic jam and I looked up and I stopped. There was a billboard there where I swear the picture of the person looked like the guy I just fired. So I saw a billboard with the picture. So I stopped and looked at the billboard and it said, job today, hungry tomorrow, call the North Texas Food Bank. And I said, that is a sign from the universe. So I, on the phone, read out the number to my wife. I said, hey, call the food bank. I think we need to be involved. This is a message for me. That person looks exactly like the person I just fired.
Wow.
And she took the number and she called that number. It was 6 o'clock in the evening. 6 o'clock in the evening, everything is shut.
Yeah.
One person picked up the phone. She was the chief philanthropy officer. Her name was Colleen Brinkman. And she said, oh, I just happened to be in the office and the phone rang, so I picked it up. I don't normally pick up the phone.
Yeah.
And she heard my wife's name and started talking to her in Hindi.
Wow.
Because she was half Indian.
Wow.
So he said, for us, that was a absolute sign for the universe that we need to get reconnected back to the community.
Yeah.
And we did. We had forgotten that we had hunger in our family. My father, when he came to this country, couldn't have 2 square meals. He came with $8 in his pocket. In fact, he was 30 pounds underweight when he entered the US shores. But he says this with pride. Why? He used to buy his shirts from a store called Arrow. That was the big brand in those days. He said, but because I was so thin, I would buy shirts from the boys' store, which was $1 cheaper.
Wow.
So we've had hunger in our lifetime. I've seen it. We'd forgotten about it. When this message from the universe came, we got significantly involved. And it's been a game changer to me to know that hunger exists right here. That 1 in 4 people don't get enough food. 1 in 4 kids don't get enough food. And that's simply unacceptable.
Yeah. So what this seva did to you? What made Anurag different with this bhav, this attitude of seva?
I don't know if I changed or not, but it definitely fulfilled something inside me. It was like a completion. It was like a coming home. The fact that if we believe in India that you have to give and receive. You can't keep taking, you can't keep giving. Exactly. And it's a closed circuit, like an electrical circuit. Right. And so for that, we had to go back. And my teacher had always said that our job is to give. But I wouldn't even say give, I would say be aligned with what is required.
Yeah, who I am or you are to give to somebody.
Exactly. I tell you, the best thing that happened to me is March 8th was my 50th birthday, 2020. And on March 9th, I got a phone call from a company that I was running, I was involved in, invested in. And they said, look, all the hospitality workers are getting laid off. And I don't know what we're going to do. This is when COVID was coming at us, right? At the same time, I got a call from the CEO of the food bank. And she said, look, more people are coming to give food. We need 20,000 volunteers to pack the food and distribute it. We don't have any volunteers coming. And it is more complex the way we give food because we have to give it in cars and boxes with no contact, if you remember when COVID originally came. And that's when an idea came, said, can we hire the hospitality workers and put them to work in the food bank to distribute food to people that needed food.
Wow.
And we started a charity called Get Shift Done. So be careful, Get Shift Done. And we ended up working in 100 food banks across 10 cities and feeding about 26,000 people that needed the food.
Yeah, amazing. So one thing which I wanted to ask you, you've been CEO of Access Healthcare. You've seen the data of the diseases and how people get paid. I'm just thinking, why we're wasting that much money there? and there is a very less emphasis on prevention. 90% of the diseases are related to your nutrition. Everybody knows it. Everybody understands. There's a tons of literature written. Research paper has been written. We spent around, in 2024, we spent $5.3 trillion on healthcare, which is 18% of the GDP. 18%. So you can see that what country will do as people are aging, and we are fearful of the disease, especially Alzheimer, and the cancer is catching up. It's becoming the number one killer in the world. So what do you see? What we need to change? Because you have seen it. You have seen those, the codes coming. Specific codes get paid more than the other codes. And so what do you think? What do you need to be changed?
Dr. You are the doctor. I don't know what procedures required or not required, but I'll answer the question this way. I do think that the system that we are in the world, wherever we are, is focused around once you have a sickness, how to make you better.
Exactly.
But it's not focused on the data before that, right?
Exactly.
And I think there is an opportunity there. It's actually, unless we do it now, the system will break, because we don't have enough money to keep fixing disease once the disease is there and to still extend life. But I do think that work needs to happen. There, I believe as a technologist that AI will help in some of that, because now if we tell them that, hey, if you do this nutrition A, B, C, D, or go back and look at what we knew 5,000 years ago or what you practice in Ayurveda, some of those things will cause disease to get better, right?
Exactly.
So I am worried that we are reading a system that's broken, that is focused on disease fixing versus prevention. But I'm also hopeful that with the new technologies that are coming, we will use the new technology to rediscover the old.
Exactly.
So hear me again. We'll use the new technology to rediscover the old. And realize that we have this knowledge, and that we can prevent disease and reduce the cost and make people live much longer.
Yeah. So just like the broken system we talked about, in medical colleges, the medical doctors are given less than 8 hours of classes on nutrition. This is standard. And just recently, there is a bill in the Senate to make it 40 hours of medical education, compulsory medical on nutrition. So, but again, if you look at it, everything starts from the gut. Now, there is a tons of literature, data available on gut biome, your brain, gut biome, your eyes, gut biome, your skin. So, I think what the body is giving clues to us, before the disease hit you, before you get diabetes. Diabetes didn't happen just yesterday. It is at least 8 to 10 years of process where you finally get broken down and you start to have the blood sugar going crazy on you. So I think with the AI model and with the new health technologies, we can, and I think I like the constant glucose monitor, because you can see what foods are going to cause you more problem than others. So I think you have a point that AI and the technology which we can use will make a big difference in people's quality of life, living longer. I am for quality of life. Nobody knows. I cannot predict that somebody is going to die tomorrow. Nobody can predict that way. But I think the quality of life certainly is in our hands. So what do you think about that? What do you think? What do you have to do to make this change in it?
Dr. You're the expert in this topic, not me. What I can do is follow your advice. I do think you're right? That quality of life is important. I do think we're extending life, but if that's not quality, what is the purpose of that? At least for me, it's not.
Exactly.
I don't want to live a long life if it's not quality. I do feel, however, that we're beginning to think about these features because we are required to. The system will break. The money's not in the system to do it. So it's forcing us to think beyond the box, if you may, the box that we were stuck in. And people like you have been practicing and preaching this for a long period of time. I think we're listening to that. We're now getting devices that we can get information, concentrating on Apple Watch or whatever.
Exactly.
I think that data, when it goes into the systems, will tell us what we already knew, which is gut biome and all the other things. But if they're validated and we can become better and smarter, this is great. I will tell you that the smartest AI researchers are predicting that if you survive the next 10 years, you can probably extend life by 30 to 40 years with what is coming our way, following your techniques.
We have also a population of 7-day Adventists living in California, which live 120, 130, and they have some commonalities. One of them is the community, the interaction between the people. The more we interact, the COVID taught us that, because when we got separated, we got more sicker. the psychiatrists could not accommodate more people in the COVID time because they were so much separated. So we are a society which thrives on communication. And there's been studies done when the partners are living together, they live longer. Even when they don't have a partner, they have pets, they live longer. So I think that element we need to bring in back and to make it a more community-based. And then I think you do so much wonderful work for at large with the community, involved with the community. And that is amazing. That will actually extend our lifespan, which we even don't understand that, but there is an amazing element to that one.
And Dr. Saab, I want to go back to what you had said.
Yeah.
Listen to the body, right?
Exactly.
And I think there is so much noise in our environment. We're so busy. We're thinking about things in certain ways that we are not listening to our body. Maybe AI will help us go back to what you already know.
Exactly.
And help us go back to the basic things of listening to our body.
Exactly.
Either through sensors and more data.
Yeah.
But ultimately, I do believe that we will go in the direction that you're talking about.
Exactly. So I really want to thank you. And I think what you have achieved is remarkable, and giving back is more remarkable than what you have achieved, because the achievement is fine, but then what you coming back to the level of you who is ready to give what you have earned is amazing. And I have all the ways appreciation for you, and with just knowing you, and coming from a wonderful background, and then achieving what you've done, and then giving back to the society is wonderful. So if this conversation have touched you, and I would like you to watch Disease Free Society podcast. We'll be bringing wonderful personalities on this podcast to see what we can do to see disease before it comes. Listen to the clues, listen to the signs and symptoms before the disease hit you, because our goal is to create a healthy environment. So we need to make everything healthy. Thank you.
Thank you, Dr. Saab.
Thank you.